For many Jacksonville residents who lack health insurance, navigating the healthcare system can be a stressful and costly burden, no doubt. And there is a new program that aims to connect the uninsured to primary care and non-emergency medical services. I am joined this morning by Paul Sapia, Chief Population Health Officer with Telescope Health. Good morning, Paul.
Good morning, Al.
And also joining us, Dr. Sunil Joshi, Chief Medical Officer with the City of Jacksonville. Good morning and welcome to you, Dr. Joshi.
Good morning, Alan. Good morning, Paul.
Good
to see you
morning,
both.
Dr. Joshi.
So I'm going to start with you, Dr. Joshi. For those that may not have heard about the program yet, obviously it was in the headlines a great deal over the previous months. What is Healthlink Jax and why was it created?
Well, so Healthlink Jax basically is this unique and innovative way for us to provide healthcare to folks who don't have health insurance and to divert them away from the emergency room and into a primary preventative care setting. And so we learned that this was truly a need in our community as the City Council put through a critical quality of life issues task force a few years ago. And as the mayor was coming into office, she had transition committees put into place. And in our health access transition committee, this is one of the big points that came up, is that people are utilizing the emergency room as a source of primary care and not really getting into the primary preventative care that keeps them healthy in the first place. So we started looking at ways to come up with an innovative way in order to address this need, in particular for uninsured patients. And it's been an amazing success in such a short period of time.
Yeah, anybody who's ever said, I have to go to the emergency room, has preceded that with, do I really need to go to the emergency room? Because that's a long wait. So I have to also believe that, and we'll break this down a little bit further with Paul as well, but that this really is about alleviating some of those pressures in those ERs, correct?
Oh, that is 100% true. And so, and also, if you talk to some of our not-for-profit clinics in town that take care of folks who don't have health insurance, and they survey their patients as they come through, about 76% of those patients admit that they've gone to the emergency room between 1 and 3 times in the previous year before they were set up with a primary care provider. And of those 76%, almost 50% of them admitted that they went to the ER for a minor illness. So again, if we can keep these folks out of the ER and in preventative healthcare, not only are we providing them healthcare the right way by preventing illness, we're also keeping our emergency rooms from being overburdened with folks who may not need to be there to begin with.
It's all in the data, and obviously there's a number of benchmarks that are far beyond our pay grade in this short period of time we have here. But just give us a sense, Dr. Joshi, how many people are uninsured in Jacksonville, and what typically are the reasons that people are uninsured? I think there's some misconceptions around that.
Right. And not all uninsured people are uninsured because they're indigent. You know, some folks are self-employed, and health insurance is very, very expensive. And so going into this administration, we knew that there's approximately 120,000 people uninsured. That number is now somewhere around 100,000 folks in Duval County that are uninsured. Our Get Covered Jax program has kind of tried to highlight the importance of Affordable Care Act insurance and the fact that there are ways to get some pretty good health insurance plans at relatively low premiums if you have somebody help you navigate through the system. So we're looking at right around 100,000 people, about 10% of our population that is uninsured.
The correlation between health outcomes and how that affects communities has been a long-standing debate and conversation and dialogue. How do poor health outcomes for some affect communities as a whole? Could we grasp that to understand?
Yeah, I mean, I think it's important to realize that, you know, when you look at health outcomes and you compare counties to different counties in the state, for instance, it does impact us as a whole in a lot of reasons. So for one, a lot of the indigent population or uninsured population tend to be the ones that typically are underserved and are the ones that typically don't have a primary care provider and utilize the emergency room as their source of primary care. And as a result of that, the taxpayers fund those not-for-profit hospitals who aren't able to receive compensation for the care that they're providing. So number one, that affects us from a tax base. Our tax dollars are going to those institutions to help fund uncompensated care for folks who are utilizing the emergency room without health insurance. So that is one way that it affects the entire community. But also, you know, health outcomes are ranked throughout the state and throughout the country. And if your community tends to have lower health outcomes. That does make it a little bit more difficult for large companies to relocate if they're thinking of, my goodness, this community has worse health outcomes than a competing community. So we all win as we improve health outcomes in Duval County. And I think it's important to also remember 842 square miles. There are parts of Jacksonville, Duval County, that have fantastic health outcomes that would rank them in the top 20 of countries in the United States if those health zones were countries. But then we have other parts of our community where if those health zones were countries, they would rank in the 160s, 170s in the world in terms of overall health outcomes. And so we have a very diverse, very, very much spread out community. And of course, focusing on the areas in town where we have the worst health outcomes can improve health outcomes for our entire region.
It's such a dichotomy. When I travel across the country, people will speak about Jacksonville and say, wow, you guys have such a great system there. And yet when they think about Jacksonville or talk about the health of Jacksonville, it sometimes has a negative flair because we are so dispersed and so rural. But that's why Telescope Health was in part created. Paul, tell us first of all, what is Telescope Health and the service that it provides, and then we'll get into the relationship with the city.
Yeah, absolutely, Al. So Telescope Health is a data analytics and telemedicine company. So we work with accountable care organizations, physician practices, hospital systems, health plans to really engage patients in their health. And so if you think about a standard telemedicine company, it's an episodic piece of the puzzle, right? It becomes standalone. It happens and never gets back to your primary care physician. So we work with all of these organizations to kind of create a unified system where if a patient is seen in telemedicine, that note gets back to their primary care so that they know that there was an issue, they know something happened, and what the physician that saw them prescribed. So we've taken that same piece of the puzzle and brought it here to the uninsured population here in Jacksonville. So we are a physician-owned company, started here in Jacksonville, really looking at the basis was the emergency room was seeing a lot of patients that didn't need to be there. So how could we create an emergency room access point for patients without having to go to the emergency room? So we're staffed by emergency room physicians. It's a virtual medicine company, but we also have a nurse navigation component. So we can bring in, get patients connected to a primary care or other resources that they need within the community.
So it's really kind of a loop versus a disconnect, meaning they come in and then it's gone and there's no way to track it.
Absolutely.
So what are the types of non-emergency conditions, you guys traditionally...
a common cold, bronchitis, UTIs, we can see those, dermatitis, those type of dermatological issues. We can see a lot of those type of things. We can also just connect patients, right? A lot of times patients are lost. My head's been hurting for 3 or 4 days. I'm not really sure. Do I need to go to the emergency room? Do I need to go to the doctor? What do I do? And if you don't have insurance, that becomes even tougher because now you're where you can go is limited, right? If you have insurance, you've got a network of providers. You can go to the primary care physician. If you're uninsured, you have one option. That's the emergency room. Mm-hmm. And you're going to end up in the emergency room. And it could be something you're just dehydrated, right? And you've got no other issues. So something like that our primary care physician, our emergency room physician, or nurses on for the virtual care, they can actually get you to where you need to go in the right place.
Dr. Joshi, having myself worked for about 6 years in the emergency medicine and hospitalist medicine field, in the earlier days when telehealth was just first starting to kind of peer its head into the public domain. And I know that there's sometimes a concern among patients and the public, can I really get the type of care? You're a clinician, chief medical officer for the city of Jacksonville, obviously stewarding this project and this program. What do you say to even somebody that's uninsured that has doubts about, hey, is this telemedicine? Does that really work? Can that work for me?
Right. And that's a great question too, because we struggle with that in practice all the time, is that how do you adequately take care of a patient if you're not getting their vitals and things of that sort? And so where this really works is for those minor illnesses, as Paul was discussing, somebody who might have an upper respiratory infection, bronchitis, sinusitis, urinary tract infection, back pain, cellulitis, a skin infection, these types of things where the history, talking to the patient gives you a lot of information. And yes, you can't touch the patient, you can't do the vital signs, but you can at least help the patient virtually for those conditions. Now, again, if it gets to the point where it doesn't seem like we're able to get enough information just virtually through communication, that's when the patient does need to go to the emergency room and or go in to see a primary care provider the next day or even later that day. And that's something that the physician on the other end of the phone, the other end of the virtual visit, can recommend and try to set up for the patient as well. So this is really a way to get those folks who otherwise really can be handled virtually to be handled that way, as opposed to going to the emergency room for those types of services.
Well, I don't think you can underscore enough too to the naysayer who may be insured and be a skeptic. I think the impact they're going to see not only in the quality of care increasing because there's less overutilization. So with that being the case, you launched fall of last year. Dr. Joshi, what's been the impact of the program thus far?
Yeah, it's amazing. So, by the time we actually kicked off the program with a press conference and all of that in middle of August of 2024, that's only been about 6 months since we started. And in those 6 months, Healthlink Jax has touched about 1,500 different people, whether it was through direct physician contact or through social services or through the nursing care management team, and have kept about 900 to 1,000 folks out of the emergency room with a financial impact of about $3.8 million. So by keeping those 900 people out of the emergency room, where each emergency room visit, uncompensated emergency room visit, costs about $4,000, you're looking at a $3.6 to $3.8 million impact here in Duval County, just simply by having this program in place for the last 6 months. And so, again, we feel very excited that the future is going to be great for this program as we go forward, and especially as the word gets out. And it'll start to save, the emergency rooms in hospitals from uncompensated care, and they'll be able to see patients much more efficiently and get paid for them as well.
Yeah, and this is taking advantage of not just the technological opportunities and the quality of that exists in that technology, but really expanding the brain power of these clinicians who can now serve more.
Yeah. And one thing I do want to point out, so Dr. Joshi mentioned, the emergency room physician seeing, we also have nurse navigators, right? So we've had a lot of patients call, like we had a patient call looking for diabetic needles. Couldn't afford the ones that she could find. They were $65. She was able to talk to one of our nurses. We were able to navigate her to a place to get those needles for $15. And it was walking distance from her house. So that just saved her, having to go to the emergency room to get those because she was uninsured. She could afford the 15, but she couldn't afford 65. And so, those nurse navigators really take the time to understand what programs are available within the community and how we can steer patients. So somebody could call the number 904-925-CARE. And
what was that again, Paul?
904-925-CARE.
Nice job, Paul.
2273. And so the nurse can actually navigate somebody. Somebody has a question. Where do I go? What do I do? How do I get this medication? Mm-hmm. And they can steer them to the right place to get it. And they never even have to see a doctor.
So I sometimes it's important to restate the obvious. For those of us that are insured and our insurance companies offer these services, which still are underutilized, by the way, that's what the data says. This is that same resource for the uninsured. If you're just joining us, we are talking about a partnership between the city of Jacksonville and Telescope Health that provides free telehealth services to Duval County's uninsured. And there are more than you realize. You can join the conversation if you'd like to by calling 904-549-2937. You can also email firstcoastconnect@wjct.org or reach out to us on social media. Dr. Joshi, how does Healthlink Jacksonville speak to the importance of the mayor's vision of this public and private partnership? And is this maybe a model for other programs?
Oh, 100%. And so this is truly the epitome of a public-private, not-for-profit partnership. So, City of Jacksonville, Telescope Health as our private partner, and then a lot of our not-for-profit community health centers throughout Jacksonville. So through Jax Care Connect, which is where these patients, if they're diverted from the emergency room, do not have a primary care provider. Our friends through Healthlink Jax will try to schedule them to have appointments through the Jax Care Connect system, which then connects them with 7 of our free and charitable clinics here in Duval County. And so this is a way for these folks to get that primary preventative care and to keep them out of the hospital going forward. And so when they do end up getting into the primary care system, remember we talked earlier that 76% of these folks utilize the emergency room between 1 and 3 times in the previous year. Once they've been in with one of these free and charitable clinics for a year, only 24% of those folks went back to the emergency rooms. That's a significant reduction in emergency room utilization. So a perfect public-private, not-for-profit partnership. And it's that collaboration that's going to allow us to do many other great things in medicine. We know that our Healthlink Jax team is now trying to work with mental health resources in our 988 system through the United Way, and we'll work with the pediatric providers as well. So again, we are collaborating in a way to improve health outcomes so that everybody wins.
All right, we only have another moment, real quickly, and Paul, what is the next step for Healthlink Jax with Telescope Health?
Yeah, absolutely. So I think it's, continuation of this program here in the city of Jacksonville. As Dr. Joshi stated, we've had a huge financial impact, but it's also a huge social impact. The patients that typically are underserved, that are not getting the care that they need, they now have an easy access point. It's a phone number you call, you get a live person on the phone, we send a text link to your phone, email to your device, and you're connected, right? So that's super easy, very, very impactful. The next step, hopefully, is to continue to build into the surrounding counties. There's a lot of people in Nassau, Clay, St. John's, that come into Jacksonville to work, that utilize our emergency room system. And so it's expanding out into there, and then continuing to use this, to highlight the innovative approach that Jacksonville has taken to address this population.
Dr. Joshi, we have just under a minute, so in 30 seconds, how does it feel to sit in the cockpit of this program, and what do you most want to tell the public?
Yeah, it's fantastic. And so, we continue to learn as we grow. And I think what's really important for the public to understand is that by providing healthcare, giving folks who otherwise don't have access to healthcare an opportunity to stay out of the emergency room and get the primary preventive care that a lot of us take for granted, really will impact health outcomes and make it easier for every citizen in this community to utilize the emergency room when they really need to, so they're not backed up with hospitals taking care of folks who don't really even need to be there. So this is a win for every single taxpayer in Duval County.
Fantastic. Paul, what is that number one more time in your radio voice?
904-925-2273 or 925-CARE.